Good afternoon, everyone, and our apologies for the brief delay. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Over the last 24 hours, we have identified 1,646 new cases of COVID-19 and completed about 17,200 tests. Our positivity rate currently stands at 9.5%. We have identified 1,020 additional cases of variants of concern in the last 24 hours. Variants currently represent about 54% of our active cases. There are now active alerts or outbreaks in 478 schools, which represent 20% of all schools in the province. Yesterday, Alberta Education moved grades 7 to 12 to online learning in all Calgary schools. To complement this decision, effective Monday, all extracurricular youth, sport, recreational, and performance activities within the City of Calgary will be required to either take place outdoors or be paused during this same 2-week period. We know this may be disruptive to families. However, by shifting these activities outdoors, they can continue in a lower risk setting. We will update the website and alert stakeholders of this change as soon as possible. As I've said before, we are seeing a sharp rise in cases among younger Albertans in this third wave, along with all other age groups. While the change to move older students online in Calgary was an operational decision, I support it. The best thing we can all do to reduce cases in schools and all other settings is to stop this virus from spreading in our communities. We all need to help reduce transmission. I would ask that all parents and students continue making safe choices and remember that social activities outside of school can easily spread the virus and put schools at risk. There are now 416 people in hospital being treated for COVID-19, including 86 in the ICU. We have now administered more than 1 million doses of vaccine in the province. I am also pleased to announce that Alberta Health Services will soon implement a program to immunize eligible long-stay patients in acute care facilities across the province. Patients who are eligible will be able to receive their COVID-19 immunization on-site while in hospital if they wish. Eligibility will be based on a variety of factors, including the provincial rollout plan, length of stay in acute care, and the patient's medical condition. We expect this program to be available at all acute care sites across the province within the next few weeks. Sadly, 5 new deaths were reported to Alberta Health in the last 24 hours. My condolences go to the family and friends of those who have passed away. Each death is another reminder that we are not yet through this, and that the best way to help protect our friends and family is to bring down our cases. Today, I want to talk about AstraZeneca vaccine. Specifically, I'd like to talk about how you can get the vaccine, how rare the blood clots that have been reported really are, and what benefits the vaccine offers. Right now, the vaccine is available to anyone in Alberta between the ages of 55 and 64. You can book an appointment at participating pharmacies across the province or online with Alberta Health Services. I am also pleased to announce that walk-in vaccinations are available at 26 participating pharmacies in Calgary and Edmonton. AHS will also open 2 walk-in AstraZeneca vaccine clinics on Saturday in Calgary and Edmonton. While these walk-in locations are limited to Calgary and Edmonton, you don't need to live there to get your dose. Anyone in the 55 to 64 age group, regardless of where they live, can walk into these locations and receive their vaccine, or find a participating pharmacy nearby to make an appointment. I know people have a lot of questions about this vaccine, specifically how well it works and what the risks are. It's important to understand this information to make the choice that's best for you. First of all, the main benefit this vaccine provides is how it protects against COVID-19. AstraZeneca's first dose reduces infection by 60 to 70% and reduces hospitalizations by 80%, including against the B117 variant. Like any medication or therapy that has benefits, there are also some risks. The most discussed risk that has been associated with this vaccine is rare blood clots that the Public Health Agency of Canada is calling vaccine-induced immune thrombotic thrombocytopenia, or VITT, VIT. Essentially, this means that in rare cases, the vaccine can trigger platelets, which are a clotting agent in our blood, to clump together. This can cause blood clots to form and lowers the number of platelets in our blood. VIT is treatable. That's why it's important that everyone is aware of the symptoms, such as severe and persistent headaches or abdominal pain in the 4 weeks after receiving the vaccine, and anyone experiencing them doesn't hesitate to seek medical attention. With all the coverage that's out there, it can be easy to lose track of how rare these blood clots actually are. Let me give you an example. In the United Kingdom, where about 20.2 million doses of AstraZeneca vaccine had been given up to the end of March, 79 of these blood clotting events were reported in that time frame. That means that 20,199,921 people benefited from the protection that their AstraZeneca vaccine gave them and did not experience this rare side effect. So far, there has been one confirmed case in Canada and none in Alberta. We have received a small number of reports of people who have experienced blood clots in the 4 weeks after receiving an AstraZeneca vaccine. These are all being investigated to determine whether they are VIT cases. This involves a detailed clinical review by health officials and additional testing in some cases. The type of blood clot that is associated with the vaccine has a characteristic combination of low platelets as well as blood clots, and specific tests are required to determine if cases meet the criteria. We will let you know if a case is identified. These reports and the associated follow-up are signs that our safety system is working. We are closely monitoring all vaccines to protect your health and maintain transparency to ensure informed consent. I know that any report of a side effect can be scary, especially when it comes to new treatments or vaccines. However, let's look at the numbers. The global frequency of VIT has been estimated at approximately 1 case in 100 to 250,000 doses of vaccine. In Alberta, someone between the ages of 55 and 59 who is diagnosed with COVID-19 has a 1 in 200 chance of dying from that infection. Risks are even higher of ICU admission and hospitalization. Albertans between the ages of 55 and 64 are at least 1,500 times more likely to be hospitalized from COVID-19 than experience VIT after getting AstraZeneca. This tells us that the syndrome is very rare, and in this age group, the risks of serious harm from COVID infection are much greater than the risk of this rare outcome. For anyone infected with COVID-19, they are much more likely to experience a blood clot from COVID. About 1 in 4 people hospitalized with COVID get blood clots. We don't yet have enough vaccines for everyone in our population, and those who would otherwise have to wait a month or more for Moderna or Pfizer vaccine can choose protection now instead of no protection while our transmission rates rise. While not getting vaccinated may feel like a way to protect your health by avoiding the rare risk of a blood clot following vaccine, waiting can actually increase your risk of getting sick or worse. It's also important to remember that in the general population, blood clots happen more than many people realize. Other forms of blood clots can occur after a wide variety of conditions or medications. By taking birth control medication, ibuprofen, and many other types of medications, we are also exposing ourselves to an increased risk of experiencing various forms of blood clots. We accept that risk because it is very small, and because it is far outweighed by the benefits that come from getting the treatment or medication we need. The same principle applies for this vaccine. AstraZeneca's benefit is preventing infection and severe outcomes, and the risks are rare. Yesterday, Health Canada released an updated review of AstraZeneca's vaccine. It concluded that though these rare events may be linked to the use of the vaccine, the risk of them is very low compared to the risk of catching COVID-19 and the associated long-term health effects, hospitalization, and in the worst cases, even death. The World Health Organization and European Medicines Agency have issued similar recommendations. With cases rising, it is more important than ever that as many of us as possible are protected now instead of waiting. If you are 55 to 64 and not part of Phase 2B or 2C, it will be many weeks before you can get a vaccine, and it will take another 2 weeks after getting your first dose to build up some immunity. This means that delaying getting AstraZeneca is putting your health at increased risk during this time of waiting. If you are in that eligible group and have more questions, please speak with your family physician about any questions or concerns. Rely on proven information, not rumors. I also know that some who are younger than 55 are interested in getting the protection that this vaccine offers. Given the Health Canada assessment, we will be discussing this question with our Alberta Advisory Committee on Immunization this week to get their perspective. Because AstraZeneca appears to grow more effective the longer you wait for the second dose, we will continue waiting 12 weeks before giving the second dose, no matter the supply. There are no risk-free options with COVID-19, and this includes delaying getting a vaccine. It is my professional opinion that the benefits of these vaccines outweigh any rare risks that may be associated. Vaccines save lives, and vaccines will get us through this pandemic. As soon as you are offered a vaccine, whichever it may be, please take it to protect your health and the health of those around you. If you are eligible for AstraZeneca, please book your appointment as soon as you can, or take the opportunity of walk-in vaccination. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. We have a very full queue, but we will try and get through as many as possible. Operator, could you put through the first caller, please?
Thank you. Kevin Nimick, CTV.
Hi, Dr. Hinshaw. Today, New Brunswick's Chief Medical Officer of Health said even once you have received a vaccine, you must continue to follow public health rules such as wearing a mask in public places and maintaining physical distance. Do you agree with this?
This is currently our policy, and it's due to two things. The first is that even after getting a vaccine, first of all, it takes several weeks after getting the shot before any level of protection builds up. Second of all, even after that time period, no vaccine is 100% effective. And with a very high level of the infection in our communities, the risks of potentially getting an infection and transmitting are therefore higher. And the final thing is that others around you don't necessarily know whether you're immunized or not. And so if you're not following the rules, if you're not masking, it can contribute to setting a new norm where others around you who may not be vaccinated may be more likely to also not follow the rules. So for right now, it is important that even if you're vaccinated, you continue to follow all of the public health measures.
Kevin, is there a follow-up?
Yeah, given that, do you think the Premier is being realistic in saying thousands of people will be able to attend a Calgary Stampede in July?
There's a difference between the requirements to follow these rules right now and a point in time when we anticipate, if we see the kind of vaccine uptake that we understand we'll have based on our polling data and how many Albertans are telling us that they want to be immunized. If we're able to achieve that result by June, when all adults in Alberta are eligible to be immunized, then the level of protection in the population will be much, much higher. And at that point, we absolutely may be able to ease some of those measures, but it depends on vaccine uptake. And it also depends, of course, on our ability to bring down that pressure of infections that currently is causing a significant risk.
Operator, could you put through the next caller, please?
James Keller, Globe and Mail. James, your line is open.
Oh, hello. Sorry. Can you hear me now?
Yes, we can, James.
Sorry about that. Hi, Dr. Hinshaw. How significant has interprovincial travel been in terms of driving infections in Alberta and variant cases in particular?
We've seen some introductions, particularly of the P1 strain from interprovincial travel, but in general, I think that an introduction of a particular virus will only cause spread if our collective activities put us in contact with other people. So I think that while interprovincial travel is one part of the equation, of course, the ability of those viruses to spread further is up to us, and our ability to put measures in place to stop them is within our control.
James, is there a follow-up question?
Yeah, I know that BC is reportedly considering some sort of interprovincial travel restrictions or guidelines or whatever. Is this on the table in Alberta, especially in light of the variants? We've heard stories of the P1 variant, for example, being imported from British Columbia.
I think that interprovincial travel recommendations remain in effect. So I have been clear for several months that I do not recommend non-essential interprovincial travel. And so that remains consistent. Whether or not any more formal restrictions would be put in place, again, would be up to discussions between leaders of the provinces to determine if that's a framework that they're wanting to put in place. But again, whether or not there's introductions of the virus, and that's again why I do strongly recommend against any interprovincial travel that's not necessary at this time. If there are introductions, the ability to stop the spread is in our hands.
Operator, could you put through the next caller, please?
Vincent McDermott, Fort McMurray today.
Hi, Dr. Hinshaw. What is the criteria that must be met for the province to move classes online, like what happened in Calgary, especially with rural communities seeing sharp rises in active virus cases? Like, will the school division have to reach out to Alberta Education as the Calgary Public and Catholic divisions did? Or is there a threshold for cases where the province ends up intervening in a community?
From a public health perspective, if there is a particular location, again, whatever that location is, whether it's a school or any other location, where from a local outbreak management perspective, there's a health recommendation to change operations, then that particular conversation would happen again at that local level with the school, the medical officer of health, and it would involve conversations with the health ministry and education ministry. From an operational perspective, as happened in Calgary, the details in terms of the criteria and the process would be best provided by Alberta Education in terms of that educational operational framework.
Vince, is there a follow-up question?
Nope, no follow.
Operator, could you put through our next caller, please?
Paige Parsons, CBC.
Hi there, Dr. Hinshaw. We've heard from AHS today that they're seeing some low appointment numbers for the two large rapid flow clinics in Edmonton and Calgary, where they're only offering AstraZeneca. And you've already spoken about its efficacy and safety today, but practically speaking, what can public health officials do to unring the bell for people who have it in their minds now that they don't want AstraZeneca? And is some of that fear irreversible?
It's important to, in my opinion, be really clear with Albertans about the information that we have. And I recognize that there are many that are concerned about this rare risk of blood clots or that may have questions about the efficacy of the vaccine. I'm not sure that, again, my intention is not to have people feel like they're being coerced, but rather to give them the information so they can make the best decision for them. Because I think ultimately the most important thing for me is that people understand how important vaccine safety is, how seriously we're taking it, and the reasons why we made the decision to change the age category, and as well the process that we're undertaking now to determine whether or not it's appropriate at this point to offer that protection to others at a younger age. And so then Albertans can make the decision that's right for them. But ultimately, this is about making sure that people have every opportunity to take advantage of the protection that's available to them today, and that they have all the information they need to make that best choice for them.
Paige, is there a follow-up question?
Yes. On those age groups, so as of yesterday, 24% of 55 to 59-year-olds have had their first dose of the vaccine, which is the youngest group listed, so that probably makes sense to a point. But based on the polling data that you said you have about immunization, is that number where it should be, or are we seeing a lower number because of some of the reluctance in regards to AstraZeneca?
I think it's difficult to speculate. We know that we've only opened the opportunity for vaccination to that age group within the past week to 10 days. I think I have to check the dates on that, but it has only been available since we did get the subsequent shipment of AstraZeneca vaccine into the province. And so the percentage that you're quoting is not the final percentage of those who in that age group who've said to us they're willing to take a vaccine. Again, I absolutely recognize that there will be some who want to wait for the mRNA vaccine. I just want to make sure that as they're making that decision, whether they wait or whether they get AstraZeneca now, that they're aware of the risks of waiting as well as the benefits of AstraZeneca, and again, the full knowledge of what that very small risk of blood clots entails.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Generally speaking, what have you seen in terms of vaccine hesitancy in Alberta? And can you compare AstraZeneca uptake with Pfizer and Moderna?
I think we've seen people who have a lot of questions. I've certainly heard a lot of questions about the vaccines being new products and wanting to understand how they've been tested, what kinds of processes we have in place to monitor their safety. Lots of questions about how they work. That's part of the reason why my team and I have been working to set up stakeholder meetings where I can directly have conversations with different key stakeholder groups to answer those really key questions about vaccines, what the differences are, what the similarities are, again, what the benefits, what some of the risks are. And so I think, honestly, the majority of the questions I've heard have been, again, very reasonable questions, people wanting accurate information, wanting to understand how they what they should expect after getting a vaccine. With respect to the AstraZeneca versus Pfizer and Moderna, clearly the information that's been released with respect to this rare risk of blood clots has changed people's willingness to get AstraZeneca vaccine in the last few weeks. And so we have seen a reduction in the number of people. If we're looking at the willingness of people to receive different vaccines, that has gone down with AstraZeneca. But again, if we were not transparent, if we did not disclose this information, we would be doing Albertans a disservice. And so again, our intention is not to twist people's arms, not to coerce people, but simply to be transparent, to offer the information and to offer them that choice of protection, especially now that we have a better understanding of the magnitude of the risks of this particular syndrome and the kinds of things that can be done to very quickly identify and treat it should it occur.
Julia, is there a follow-up question?
Yes, thank you. We are now in phase 2C, but Albertans still have no idea what phase 3 could look like. Can you give us a sense of how that part of the rollout could work?
Sure. Certainly there's lots of discussion about the phase 3, and again, we anticipate that phase 3 will be happening. We expect to move into that. Again, this all depends on vaccine supply. And so we know that in the past while, we've had some shipments of some particular vaccines where dates have shifted on us. And that always, of course, creates a little bit of uncertainty when we're looking out and predicting when different phases might start. But we do anticipate that we would be able to start phase 3 in sort of mid to late May, again, depending on the shipments of vaccine and the timing. And we anticipate that phase 3, at that point, if we receive all of the vaccine we anticipate, will only take a few weeks to move through. So I want to reassure all Albertans who are not currently in phase 2 that when we open phase 3, we anticipate being able to move extremely quickly through the rest of the population, and that our goal is to get every vaccine that arrives in Alberta into the arms of an Albertan who wants it as soon as possible.
Operator, could you put through our second last caller, please?
Thank you. Yes, Bill Fortier, CTV News.
Hi, Dr. Hinshaw. We're hearing from a lot of people who are younger than the age group that's currently eligible and don't have any health conditions who are getting shots. So we know individual pharmacies are making a choice to create a waiting list and giving vaccines to people who don't qualify when appointments are left untaken. And they say they're doing that so they don't waste doses. So I'm wondering, what is the official policy for these pharmacies? Should they be doing that? Again, their reasoning is they don't want to waste doses, so they're filling the appointments even if people aren't technically eligible.
The vaccine is, of course, licensed for use in those who are 18 and up, and we have paused formally use in those who are under 55. So again, we're working with pharmacies to help them understand the current policy. However, as I mentioned, given the Health Canada assessment and statement just yesterday, it is quite possible that that policy may be changing depending on the assessment of our national and provincial immunization advisory committees. So we will be working with pharmacies to make sure they understand current policy, but also understand when and if that policy shifts, what the appropriate processes are. Again, right now, it's not a part of our recommendations to offer vaccine to those under 55. However, the vaccine is licensed in that age group, and so we'll continue to work with pharmacies to find a good path forward to follow the recommendations in the next little while as we work to determine if we're going to be adjusting our policy.
Bill, is there a follow-up question?
Sorry, just to be more clear, I'm not talking about AstraZeneca here. I'm talking about any vaccine. People in their 20s are getting them at pharmacies because the pharmacies are starting waiting lists and saying, well, I don't have someone in group 2A, B, or C waiting for a vaccine, so I'm going to give this shot to a 24-year-old healthy person who signed up on a waiting list. So I'm not talking about people under 55 getting AstraZeneca. I mean getting any shot. Should pharmacies be giving the shots out to people who are not eligible because they don't want to waste them?
Thank you for clarifying, and that is not something that should be happening. We have heard reports, and wherever we've heard reports that a pharmacy or any location is doing that, we have been following up. I want to reiterate, of course, we don't want to waste any doses. However, we're working with pharmacies to help them create waiting lists of those who do have chronic conditions, recognizing that the chronic condition list is a self-report honor system. However, if somebody presents to a pharmacy, indicates they have no chronic conditions, they should not be put on a waiting list unless, again, they meet a criteria such as being a healthcare worker or one of the other criteria in the currently eligible groups. So we are working as we get those reports and working to make sure that pharmacists understand that even waiting lists should be made up of individuals who either meet the healthcare worker, age, or chronic condition eligibility criteria.
Operator, could you put through our final caller, please?
Nami Hudas, Post Media.
Hey, Dr. Hinshaw. Both you and Premier Kenney have alluded this week to the potential for increased restrictions if numbers don't trend down. You even said that we can't wait a few weeks this time to watch some of the metrics this time around. My question is, this is the third wave. We've seen the province go through enough turns on the roller coaster to know how COVID trends work, and plus we have the variants to worry about this time. And I think a lot of people are wondering, why not just get on with the stricter measures already if they're going to happen? What's your response to that?
I think it's a reasonable question, and unfortunately, again, we've also seen throughout the past year that decisions around COVID-19 are complex, that there are many implications of those decisions, and so it does sometimes take time to work through those implications and considerations. And so I think what I would say, independent of whatever decisions are made in the coming days and weeks about what additional restrictions may be in place, that it's very clear that our numbers are rising, our hospitalizations are rising, our ICU admissions are rising. It's having an impact on, for example, our ability to continue to offer in-person learning in some places, such as Calgary, and that all of us have a role to play in preventing transmission by reducing the number of in-person interactions that we have with people outside our household, And so while the multiple considerations around restrictions are worked through, again, that doesn't preclude us from taking action in the things that we do every day to stop transmission and to bring our numbers down.
Sammy, is there a follow-up question?
Yeah, thank you. And today we also learned from the province about the second death of a doctor in Alberta to die from COVID, a psychiatrist in Lethbridge. My understanding, correct me if I'm wrong, is that most psychiatrists wouldn't have been eligible for vaccines until phase 2C of the rollout, which began this week. So why wasn't that group eligible earlier on?
When we were making vaccine sequencing decisions, again, in the context of a very short supply of vaccine, we had to be very deliberate and thoughtful about where vaccine was allocated. And so in the initial round, so for example, in phase 1, when we were offering to some healthcare workers, we were looking at those places in the healthcare system where COVID-19 pressures were acute and where the introduction of a COVID-19 case could have a significant impact on that particular patient population. So again, it's extremely difficult because what I think all of us would want is to be able to offer vaccine to all Albertans who want it right away. But when we only have a small amount of vaccine, we did have to sequence, and so therefore there were some healthcare workers who accessed vaccine earlier in order to protect not just those individuals, but the settings within which they work. So, for example, home care workers who work with extremely vulnerable individuals, those who work in long-term care and other continuing care settings. And the remainder of healthcare workers, of course, as you know, are now eligible, but we just simply did not have enough vaccine to be able to provide all individuals in the healthcare system that vaccine in the early phases of our rollout.
Thank you all for joining us. Dr. Hinshaw will provide another live update early next week. Have a safe night.